call this meeting to order at 6:15 p.m. on July 27th, and we will start with the Pledge of Allegiance. Pledge of Allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Agenda item number 2 is the consent agenda. Are there any items that any members would like set aside? Hearing none, we vote on this? No, okay. Agenda item number 3 is to receive and approve the nomination of the LPS Human Resource Director. Dave is going to get him in via video.
While Dave's getting him connected, just like to do a quick introduction.
Hi Tony, can you hear us?
So Tony Dill is joining us via Zoom, I believe, and it was a very competitive process for our Human Resources Director position that was open. And Tony comes with 22 plus years of human resources experience. He's got a wife and 3 children, I believe, but that's right, Xavier?
Yep.
And Tony shared with me last week in a conversation that he has frequented Maine for many years. He's coming to us from Indiana, and he's going to join our team later this month, and he's for training with our current HR director, Wayne Gilbert. So, Tony, welcome, and didn't know if you wanted to share a few comments.
Oh, great, thank you. Can everybody hear me okay?
Yeah.
Great. No, I just to say that I'm honored to be able to join the team and support the faculty and staff of Lewiston. So really looking forward to working with Bobby, Jake, and the rest of the team. And so can't wait to get there. Love Maine as well. So.
Is there a motion? Okay. All right.
All right.
Thank you very much.
Tony, you were part of the consent agenda, so you are all set. Feel free to start back on things up.
That's
Order?
point of
That's
order.
not right.
It's not
It was written that it was going to be done with separately.
So this would be a separate motion, so someone needs to make that motion.
I move that we accept his nomination for HR Director.
Second.
Is there any discussion? All in favor? 5, 7, sorry, let me count again. 1, 2, 3, 4, 5, 6, 7 in favor. Any opposed? 2 opposed. Thank you.
Welcome.
Tony, welcome.
Great, well, thank you. I look forward to meeting all of you in person soon.
Thank you very much. All right, we'll see you, Tony.
All right, thanks. Have a good evening.
Agenda item number 4 is public input. Members of the public may address the school committee for up to 3 minutes on non-agenda items now and on agenda items later. Comments that pertain to staff, personal matters, or student issues should be directed to the superintendent or the appropriate staff member of the Lewiston Public Schools. Public comments shall be directed to the school committee and be brief, not repetitive, and related to the matter at hand. Please start by stating your name and address.
Hi, I'm Ronnie Parody, and 82 Prospect Street in Lewiston, and I'm the chair of the Public Health Committee for the City of Lewiston. I'm also your representative on the Public Health Committee, the school district. I'm here to propose that the school system has flu vaccine clinics this year at all the schools. I think it's very important that we try to get rid of the flu with the COVID. We can't do much about the COVID except for the testing. So I would suggest, we haven't had total flu clinic vaccine given for the school, and it should be for the school students and the staff. So I'm proposing to the school board, and this needs to be worked out as soon as possible, because in order to get the flu vaccine from the state, you need to get it done now. So I would suggest that it could be through health-based clinics, okay, and through St. Mary's, again, because they run a health-based clinics. And I already talked to Elizabeth Keene, who works for St. Mary's, the middle management up there, and she thought it was a good idea, and she was going to talk to St. Mary's too, and Carolyn is here today too. And anyway, we did H1N1 in 2009. I don't know who was here then, but we vaccinated all the kids and all the schools in Lewiston and Auburn. In fact, that year we did 83% of the state of Maine for kids in the school that year. Maine was one of the highest states. We had no deaths with H1N1. So I'm suggesting we do offer this free for all our staff and students.
Thank you, Ronnie. Is there anyone else that wanted to speak? Agenda item number 5, to receive and approve the school committee meeting schedule for the 2020-2021 year.
So we have in the packet the list of meeting dates that have some highlighted components that are later in the year for budgeting process if needed. And submit it to you as a proposed calendar of dates to meet.
So Superintendent Lewis, I cannot open this file up. Oh, there it goes. So this starts with September and moves on from there, is that correct?
Yes.
And could either you or Member Parks describe to us how we would add other meetings? I feel personally that meetings have come up kind of in an emergency manner, which is somewhat appropriate in emergency situations, but how else might we construct our calendar so that it has more predictability, especially through a pandemic response? And I will just offer this as an example, not as a we have to, but the city council elected to meet every week until this is resolved. And perhaps that might be appropriate for the decisions you need us to make.
I'm certainly willing to entertain what the committee would like to do.
I just want to comment on Member Ray's suggestion. I think that it's a good one. It seems to me that we're far better off when it comes to public notice and accessibility if we have a scheduled meeting every week with the option to cancel a week if necessary, than to have a situation where we're constantly having to pull emergency meetings and, you know, otherwise last-minute meetings as we have over the past, well, several months, really back to March, but certainly in the last month. And obviously we've been in some extraordinary circumstances, but while some of those things have calmed down, others continue to go, and it seems to me that it makes sense to have a schedule that reflects reality a little better in terms of how often we're actually going to need to be meeting. If the superintendent and school committee chair feel that we're only going to need to be meeting every other week, then that's one thing. But if we're voting on a schedule that is every other week, and then we're going to have, with some regularity, requests for emergency meetings, then it kind of seems like we should just have them scheduled.
Could I throw out the idea of, I think that's a great idea, by the way. Could I throw out the idea that we could add those meetings, but the meetings that would occur in between would be pandemic items specifically? I only asked that question because if we're meeting every Monday as a live school department, I think we would come up with full agendas.
I mean, it seems to me if meeting every Monday would produce a full agenda every Monday, then it kind of sounds like we should be meeting every Monday, right?
I don't know about that as the person suggesting it. I don't know how staff might need to rearrange their schedules to make that happen. I just think there's a lot going on right now, and like even as we just saw in the presentation, August 3rd was a suggested date, but we're not meeting till August 10th. I'm happy to come in on the 3rd and give my opinion on the reentry plan then, but I think in terms of predictability, it's better to have something on the books as like Member Collins was saying, than not personally.
Madam Chair,
Yes.
I want to just echo the two of them. I feel that, one where so many things have happened to this district that we've fallen behind in a lot of areas, that I know individual committee members really want to get going on some items that are just sitting out there. Every time we meet, we have a workshop piece along with a meeting, and I'm thinking, when we do this every 2 weeks, we get into a very lengthy meeting, and if we're meeting every week, we can, I don't want to bring up the other districts I worked in, but we used to alternate so that you'd have a workshop one week to be able to talk about items and then make the official meeting the following week. I think we have a ton of work ahead of us that would fill that every week between workshops and meetings. So I would echo Ms. Ray's and Mr. Collins' concerns and ask that we do meet every week.
I think the idea of scheduling meetings, or tentatively scheduling meetings for every week, would be an okay idea, in specifically addressing COVID-related items right now, because that seems to be the bulk of our emergent situations. And then, somebody mentioned that we could just cancel it probably like by the previous Thursday when the agenda would go out if it wasn't a necessary meeting. I'm not sure if having full business meetings every week is what we should be doing right now, because we do have some things to prioritize. And then once we get through this phase, prioritizing basically the school reentry, I think there'll be a lot of whittling away at that other stuff that hasn't been addressed for the last 4 months because of COVID-19. But I would be reluctant to have a full business meeting every Monday.
I'm curious, Ms. Ray, do you know if there's language in the city charter about the frequency of these meetings? And is this a modification of that language?
As far as I know, are you asking me? I assume you are.
Yeah.
Sorry.
I don't know the answer. I guess I'm asking anyone.
So can't really access the city website on the LPS intranet usually. It blocks me. But can you get in?
I don't know, I've never
If
tried,
anyone
that's
else
just
could.
outrageous.
But from my recollection, that's prescribed in procedural rules, not in city charter.
Section 5.
There never used to be, okay? When I was on school board, there was never, as long as it's public.
You'd have to come up to the voting if it's public input. This is a public input.
Superintendent
Call it
Lyons,
for public input shortly.
there's nothing in the city charter that specifies the frequency of meetings. It just says the school committee shall meet at such time and place as it determines by rule.
And our procedural rules do comment on the frequency of meetings, but the procedural rules are one of the many things that we have to address in the near future. So that's something that we could definitely cover then and then add as we need.
I would add the consideration of the committee that if we're enacting this protocol, that we do so immediately. Because while September is the start date of these conversations, I think we have conversations that need to be had about opening pandemic-related with more pressing concern in August, not wait until September.
If we're going to do this, and I'm not averse to it, I think we should also set a protocol that we're not going to meet for 7 hours out of whack. That we would start at 6, and then by the time it got to be 9 o'clock, we would end the session, and then wherever we ended, we'd pick up on the following week with what, and if there were other items that hadn't been completely addressed. We did that at planning because we used to get into these, we'd be there till midnight. You're going to do it every week. It just grinds everybody. So if you're going to do it, I would say, 6 to 9. When you get to 9 o'clock, if you're almost done something, finish that with no new items to come after 9 o'clock.
For a suggestion, how about as we're working on reentering the school, that it be COVID specific for at least until maybe October, and then once we, kind of iron out, obviously it's going to always be a work in progress. Once we iron out a lot of the major issues, then we can kind of just say, hey, it's for, full agenda or whatever it is. Because again, this plan, I've talked to teachers that I know all over kind of Northeast region, and this is going to be a constant work in progress by the the seat of your pants kind of deal. So I think, again, that should be hardcore priority, and then once we get kind of moving and kind of on cruise control as good as it gets, then it's just kind of open up to full agenda.
So can I ask a clarifying question to the superintendent, Mr. Physick? Specifically, the suggestion that it sounds like you're coming with is that these additional meetings be specifically related to the pandemic and its issues, while the meetings that are already being presented on the schedule are regular business meetings where we can deal with all the many things that this committee has to deal with, up to maybe October 1st or something. Is that consistent with what you're saying?
What do you address it first?
You.
Yes.
Okay. And Superintendent Linglis?
My interest in having the in-between meetings being COVID-specific was to make sure that we can stay to that task and really make sure that we're doing the best we can for the community in the short term. I'm not opposed to the meetings. I know there's a lot of business to do, but my idea with having that not be a full business meeting was we're going to dedicate the time. And it takes, I want to be mindful of the work of staff to create the agendas, create the folders, get things out on time, and make sure that people have what they need in hand beforehand. Is an incredible amount of work from staff that I learned about.
To follow up on what you were saying, Kieran, I don't think, and correct me if I'm wrong, but I don't think what's being said is the COVID meetings would be those in-between meetings, and the ones that are already scheduled would be just for open business of all other kinds. I think there would still be a prioritization of things, and right now the priority is COVID-related and getting our students back into learning.
Sure. I mean, obviously, we would have to be dealing with COVID-related things at every meeting. But I don't want anyone to get the perception this committee can't walk and chew gum at the same time. And frankly, we have a lot of pertinent issues that this district needs to deal with that we can't afford to shunt aside the excuse that, oh, sorry, we can't do anything because of the pandemic. We have to prioritize the pandemic. We have to put that work first. But this committee is perfectly capable of dealing with any number of other issues while we do that.
I am not for changing how often we do meetings. I think up until the school year starts, then I think that's absolutely doable for weekly meetings to make sure that we're able to vote on whatever we need to vote on and have discussions. But once the school year starts, I think that is a lot to ask of our staff. And who, I don't know if people are actually required to show up, like principals and administrators. I wouldn't want them to feel like they have to be here either every single Monday. So I would be hesitant to go over that. But I do realize that we have a lot to do, but really the majority of the stuff that needs to happen is with our staff. And we are there to just make sure that that things are being followed and things are being voted on and making sure that that process is correct. So
I'm not sure, the agenda item tonight is to vote on the calendar that starts in September, so if we're talking about adding meetings between now and September, I think that would be a different discussion. What we're here and what is on the agenda and what we should be voting on right now is the approval of this schedule, which starts September 14th, moving forward. Yes?
Well, okay, in that case, to get us towards some sort of deliberative process, I move that we adopt the schedule with the following amendment. That we add meetings such that we're meeting every Monday, regular meetings every Monday from September 1st until December 31st, where we can review modification after that. And to specify that those meetings be, that the added meetings be strictly COVID related from September 1st until October 1st. That's my motion.
Second.
Discussion?
Just offhand, I don't know, I'm not looking at the calendar, I don't know if there are Monday calendar conflicts,
There
holiday
are.
wise or not.
Labor Day is September 7th.
Any federal holiday, obviously, is a separate story.
I don't know if Indigenous people.
Indigenous Peoples' Day, Labor Day,
Don't know.
totally fine.
So I think that's a perfectly reasonable, in trying to respond to Ms. Whitla's concern. We don't want this to go on in perpetuity, so keeping it up until October and reevaluating. Because we don't know where this pandemic's gonna lead the school district, and I just feel like emergency meetings and unscheduled meetings, whatever has happened in the past, have been a real disservice to us gathering information, bringing it back, and making decisions in a timely manner. So I think this is getting at what my concern was. So thanks for entertaining the conversation.
I just want to say that the nature of emergency meetings are that they're emergent, and so it's really hard to prepare for an emergency meeting and make sure everybody's on the same page with it when it is what it is as an emergency. So the motion on the table is to add consistent Monday meetings beginning September 1st until what date?
Until December 31st. And with the exception of federal holidays, and to specify that those meetings, that the added meetings must be COVID-19 related exclusively from September 1st to October 1st, and potentially beyond that, but we can specify if we need to add.
So from October 1st to December 31st, they would not be COVID related?
No, they could be. It's just that we wouldn't be committing right now that they would be COVID related, because I think everyone understands that there are a lot of things that the school committee has to deal with that maybe aren't COVID related that we may need the time for. And again, all of this can be modified by the committee by saying we're going to cancel a meeting since we don't actually need it. It's just a question of it being preferable to cancel a meeting at the last minute because there's not an agenda to work on, rather than adding a meeting in the last minute for, I mean, just to me that seems self-evident.
Any other discussion? All those in favor? 4, 5, 6, and opposed? 3. Agenda item number 6, to receive a presentation regarding the school and district CNAs. And Colleen and Carolyn are here to present.
I think that's actually a different one.
Sorry, you're the next one, I
Yeah.
apologize.
Thank you.
Okay, sorry. Jenny. How are you?
Is it turned on the side?
Yep.
Could you try to plug in on the other side of the computer? I have had issues with that right side. Do another method? There's got it. Awesome, thank you so much. Thank you for being patient. My name is Jenny Darrigan. I am the ESEA coordinator for Lewiston Public Schools. I work on the teaching and learning team, and my role is to, well, one of the responsibilities of my role is to coordinate and facilitate the completion of the federal application, and also the CNAs for our district. So through the presentation, I'm going to define all of those 3 items, or there's a district CNA and school-wide CNAs. I'll talk about them, define them for you so that we can build some context to help understand some of the information and processes. So yeah, I'm glad to be here. I'm glad to share out some of the work that we're doing around planning and determining how we use our federal funds. I want to share out today some of the actual expenses that we're planning for in our new application. Make sure you know where to go to find more information, and all of those things. So in the school committee packet, you have copies of 6 school-wide CNAs, and CNA stands for Comprehensive Needs Assessment. You also have a copy of a district CNA and it's about a 2-page info sheet on federal funds. So I added those to the committee packet for your reference, and a lot of the things that I'll be talking about today are also noted in there. Oh, okay. Oh no.
You can come stand right by your laptop and the microphones will pick you up just fine.
Okay, thanks. Okay, so goals for today, for this, specific to this presentation, is that I wanted to make sure we shared our CNAs with you. And I also wanted to make sure that we shared out our goals and priorities of the FY21 federal application. And sharing the goals and priorities is actually, it's a requirement. So, you know, being informed, absolutely super important, and also filling our requirement of doing so. I also wanted to talk about public comment on the FY21 application, because that's something we're required to do every year. And so I'll walk through those pieces. ESEA stands for Elementary and Secondary Education Act. When President Obama in 2015 reauthorized ESSA, reauthorized ESEA Act, and made it into the ESSA Act, Every Student Succeeds Act. So those are 2 really important acronyms to know about, and it basically is our federal aid for Title I, Title II, Title III, and Title IV, and it's the law that we follow. And so all of the funding sources and the funding programs that I talk about today all go back to ESSA. The federal application is something we do every year. We are required to apply for federal funds. Maine has adopted a consolidated application approach for ESSA funding. So we apply for Title I, Title II, Title III, and Title IV in one consolidated application. In our application this year, we have 17 projects, and in each project there are about 5 to 8 mini projects. So there's a lot happening with our federal funds, and a lot of different plans. And sorry, I'm losing my train of thought here. The team that I work with oversees the spending throughout the year, and so one of our most important things for us to do is to ensure that our spending aligns with the projects and the budgets that we have approved by the state. The federal application will have detailed project budget descriptions, detailed narrative descriptions, and they always have goals. The 2-page information sheet that you have in your packet outlines the uses of federal dollars for this upcoming year. So, comprehensive needs assessment is basically a process that we use to determine the needs of our schools. We want to ensure that the plans that we create for our buildings serve the needs of our students. We do this through a needs assessment. It's a process that we have teams that work at our building levels and a team that works at our district level that walk through data analysis. In our district, in the CNAs that you have, you're going to find that each of the CNAs were created and reviewed by a stakeholder team. You're going to find that we have student academic data, student growth data, discipline and behavioral data, attendance data, survey data, graduation data, English learner subgroup data. So all of those pieces are part of that data collection work. We follow up with analysis, data conversation. The school-wide CNAs, in section 2, it's a collection of data for all students. The data is school-specific, so you'll find that there is a Geiger CNA, and the data for that Geiger CNA is Geiger students, Geiger programming, Geiger reflection, Geiger budget, Geiger narrative, and so Geiger has their own school-wide. And that's the same for all of our buildings that are Title I school-wide. They will have their own CNA. You're going to notice that the CNAs include the budgets, and also one important note is that although the school-wides are individual, they're going to collapse and be represented in our district CNA. We conduct CNA reviews every year. It's a year-long process. Our teams start that work in September, and we meet throughout the year to look through CNAs and do reviews of those plans. How do these pieces work together? The goals and priorities outlined in our plans drive our use of funds. Basically, in our school-wide CNAs, if we have identified needs, then we are allowed to use federal funds to support those needs. In our district CNA, when we identify needs at a district level, then that allows us to use federal dollars to support those identified needs in our plans. Next year, for this upcoming year, for federal funds, Title I is about $3 million. That's the number that we're looking at. Title II, $458,000. Title III, $238,000. And Title IV, $278,000. And again, we submit an application every year with detailed descriptions of our plans and budgets for these funding sources. So the goals and priorities that we have found through our work during CNA review is that we want to improve student academic outcomes through innovative and improved teaching. We are looking to, each year we set goals, and what we're really looking to do is show improvement. We want to put things in place that are going to support that movement. We're looking to increase, we have to choose our data points, and we have to choose what we think is feasible and reasonable for our growth. We're looking for 2% increase for NWEA for our students, both in reading and math. We're looking to continue to provide our STEM programs with supplies. and really some more PD planning with that work. And we're looking to increase the percentage of students meeting proficiency on the access test. So when we walk through our district CNA and our school-wide CNAs, you'll see that some of the programming and supports that we're putting in place help us work towards meeting these goals. The CNA, district CNA goals, we have 3 of them. The second one is to improve social and emotional learning. We hope that through our survey work, we can see an increase in student response, positive response, teacher and staff positive response. We're looking to implement some new SEL PD this year, paid for using federal dollars. So yeah, our goal is to build an SEL program and curriculum that reflects the needs of Lewiston students. We'll be using a lot of federal dollars to do that. Goal number 3, to provide an equitable, accessible, healthy, and informed community. For several years, this has been one of our district CNA goals. We want to increase parent, family, community participation in all of the district events that we offer. We want to increase and better the gathering of feedback from our parents. And implementing a district-wide communication tool is a huge part of that. So we'll continue to support that work with our federal money. So I'm going to walk through each title, give a brief description of what the title really, the purpose of the title is for, the direction of the title, and then I'll give the actual budget items that we'll be paying for using that funding source. Title I is designed to provide all children significant opportunity to receive a fair, equitable, and high-quality education. These funds can be used from kindergarten to grade 12. We have Title I school-wide programs in our schools, K to 8, and being school-wide allows us to use our Title I funds to upgrade the entire educational program or school program. So we have a lot of flexibility in the use of our Title I funds at our school level. So we have 6 Title I schools, and all of the budget items that are on our school-wide plans and on our school-wide Title I budgets must be identified as needs in their plan, and that's a bit of how the work kind of connects itself. The basic goal of Title I is, again, to improve the achievement of our lowest achieving students. The school-wide program, there are 3 things that we need to do each year to have a school-wide program and to apply for school-wide funds. And that's completing the CNA, the Comprehensive Needs Assessment, preparing a plan, and evaluating and revising that plan annually. Connors, Montello, Geiger, McMahon, Farwell, and LMS are all approved. Connors was very recently approved as a school-wide school, which is great news. And here are some of the project budget items for Title I. For our district projects, we use federal funds to support the ESSA program coordinator position, continuous school improvement coordinator position, a reading recovery teacher leader, our equitable share projects, which are projects that we are required to support with the private schools that reside in Lewiston. We have a district homeless programming project that we use Title I funds to support, and a district parent involvement project. How are our schools spending Title I funds? Our schools are supporting math interventionists with Title I funds on their school-wide budgets, literacy interventionists, reading recovery teachers, math and literacy coaches, ed techs for literacy math support, PD opportunities for their teachers, student learning software, and instructional supplies. Some of our school-wide budgets do include transportation, a little bit of student transportation, some staff travel for professional development work, other professional memberships, and once in a while, a technology expense, like if there was a new staff and they were paid with federal funds, we would use some Title I funds to pay for the things that they need. Title II is really our funding source that helps us support professional development. So we are, Title II is managed at the district level, and we have a lot of PD projects that we have planned for every year. We'll sit and we'll do that planning out. Title II can also support PD at the building level as well. We do use it that way for sure. Current for this next year's budget and for many years, Title II has supported class size reduction teachers. We currently have 4 class size reduction teachers paid out of Title II. Statute allows us to determine and still pay for that. Smaller class size supports early learning grades, and so we have 4 teachers, 2 at Montello and 2 at Commerce paid with these funds. Title II, we plan to pay for the UMA Literacy Math coursework this year, the Teachers College Units of Study CD, our National Board Certified Teacher Stipend, Educator Effectiveness Project, again, a lot of PD, Literacy Math, STEM Writing Workshop, and our Equitable Shares projects, which we're required to do. Title III for English language learners. Title III, the purpose is to support our English learners and immigrant children to receive a high quality education. It's important to note that states and districts, when we're talking about Title III, states and districts are required to provide core language instruction program services. So Title III is supplemental and above and beyond what we're required to do. Our requirements come in service requirements, professional development requirements, interpretation, translation requirements, and many of those pieces are required, we're required to use local funds for that. But Title III is in addition to. We are currently planning to pay for an ELL interventionist at the high school with these funds. 50% of EL coach that is shared between LMS and LHS. 50% of our K-6 ELL coach. Instructional supplies and software. You'll see that the word VISTA up there. That's going to be a new EL-specific learning program that we're going to be implementing, and we were able to fit that on the Title III budget. Any additional professional development that's above and beyond what we're required, we will be planning for that, and parent involvement for EL. And our last title here is Title IV. Title IV allows us to support enrichment opportunities for our students, and in the past several years, Title IV funds have really been dedicated to our work with ESEAESSA, to our work with staff, and supporting our 21st Century grant. We paid for several positions to keep 21st Century at full capacity for the programs that they've been offering. We also offer some guidance supervision for Title IV. We have a new counselor PD project that we'll be supporting this year. We have our district SEL and equity coordinator who's paid out of Title IV. A behavior interventionist shared between McMahon and Farwell, RTI behavior teacher, behavior strategist at Montello. Again, we will be continuing to support some 21st century positions. And PD that's specific to SEL can fall under Title IV. And St. John's and Margaret Murphy will also be participating. So, for more information about this work, or for public to receive information about this work, we have an ESSA information page on our website that will have the school-wide plans, our district CNA, additional information, ADOE links, everything I've shared today and more about how we do this work. So again, I guess I'll go back to the goals. And I'm happy to answer any questions about the school-wide or the district CNAs that you folks have. I wanted to share the goals and priorities so you can see how some of these determinations were made, and also talk about that public comment piece. On the district website, right on the front page, if I do this, will it bring here right there? There's two buttons right here on the home page. This is going to be the summary of the use of funds. And this is going to bring you to a Google form where you can share thoughts or ask questions or make comments about that. And before we submit our application, we review all of the public comment for that and take it into consideration. Any questions that I can field? Yeah.
So during all your slides, I noticed you quote a lot of schools, but there was one school that was missing, and that was Longley, where we're attempting to prepare an alternative education program, Impact Academy, outreach for the homeless. Is it on the radar right now? I mean, are we able to take a look at redirecting some of these title funds to that, since a great deal of those students are going to be disadvantaged students? So I was wondering where Longley is fitting in there.
That's a great question. Oh, sure.
You may have a more clear answer from that perspective, but as part of the agreement with title funds, school-wide, there are limitations to different school groupings and how the funds can be used. And so the elementary schools and middle school have primary Title I dollars. There's some crossover in other titles. But I think what part of the question is, can we use Title I funds along to help support the mission there? And I guess what I'm saying is, from a secondary ed perspective, there are limitations to that because it's dedicated in addition to part of our plan for K-8. Carrie, you may want to add to it.
Yeah, I just want to, I think it'd be helpful to say that the only funds currently that would not apply to Longley or LHS or any other high school program would be Title I. All the other titles, those funds do benefit the high school and Longley and all of the other 9-12 programs that we have. So professional development, Title IV, all of those things. They do support the high school and Longley. Title I funds currently do not. The high school is not a Title I school, and there's a lot of reasons for that, and I can get you some more information about that. But currently, high school is not, and Longley, the programs at Longley would be considered part of Lewiston High School. So the other funds, Title II, III, and IV, all do apply to all of our schools in Lewiston.
We do have additional funds that do support our homeless programming for the district pre-K through 12, and that's called McKinneyVento. We just secured $78,000 to support our program this upcoming year. And we also just secured a J.T. Gorman grant of $10,000 to support some of that work as well. But it would be wonderful to sit down and have some more conversation about how maybe those funds now or in the future can support some of the work that's happening at Impact.
Are you nodding at me?
Yes,
Okay.
said your name too.
I can't hear. So Jenny, could you tell us how school committee members have been involved in the CNA process in the past, and if anyone participated this year? And then the second part of that question is there any action that the school committee needs to take for these applications to move forward?
Okay. So there is nothing that the school committee needs to do to make these, have the application move forward. But we'd love to have your comments and your feedback and your thoughts, and that can be done possibly in addition to the form. We can set up a time to do that, in a different way. This year, Megan Parks joined the district CNA team, and my understanding for that is that annually we'll be inviting school committee members to join either the district CNA team or the school-wide team. So if you have an interest in that, then I think please reach out to Megan about that, and she can connect you. We would love to have a school committee member on each of our teams, each school that creates a school-wide plan, and also on the district. So I would love to see that happen. We've been working really hard to have representation for all of our teams. The district CNA had 21 members this year, representation from administration across every school. And I think the community member stakeholder has been difficult to fill, and so we want to really continue to work to recruit for that. And yeah, great, thanks.
Do we gain access to more federal money when we have more schools that are qualifying for various titles?
Would we get more if we had more schools?
Specifically, is the fact that Lewiston High School isn't a Title I school
Right.
making us lose out on money, or does it just mean that we can't distribute some of the money that we would be getting to Lewiston High School?
Correct. We're receiving as much as we possibly can,
Okay.
and we're choosing to use Title I funds specific for K-8 schools.
Gotcha.
Yeah.
Okay.
And again, the title, like Karen had said, Title II, Title III, Title IV, we build district projects to meet the needs of the schools, and that can be just access to funds through proposals, and also really supporting a position at that building.
Thank you, Jenny. Agenda item number 7 is now the CCS presentation, and it's not here that Bobby will be presenting. No? Okay.
Carolyn.
Go for it, Bob. You guys don't take another break. You guys are very hardcore. So ours is on in the Google Drive. Can you pull that up? I don't want to touch the computer.
She may not, Jenny, you might not have access to it.
Really?
I do, though.
Okay. Because it's on the, you posted it to the Google Drive. Suzanne did it today, so. Just don't want to touch your computer if you don't. Okay. Social distance. So, hi guys, I'm Carolyn McNamara. I'm a nurse practitioner at B Street Health Center, which is part of CCS, Community Clinical Services. We also run the school-based health centers in the school, and we're affiliated with St. Mary's. A lot of what I was going to touch on, I think you guys have already touched on in your conversations about re-entry, so I'm going to try to zip through this and get to the meat. Please interrupt me. Sometimes I slip into medical speak, and I'd like you guys to just raise your hands and slow me down or whatever you need. Our CEO, Colleen, is there in the back, and if there's questions on the administrative level, we'll direct those to her. So, as you've all been talking about, of course we have a vulnerable population. We want these kids in school if the opportunity does present itself. A lot of national organizations have recommended that, but of course we need to do it in a safe way. For positive cases, we want to provide an overview of what kind of testing is available in the community to minimize unnecessary large groups of kids being out of school. At B Street specifically, across all income levels, we've seen huge increases in, pediatric obesity, type 2 diabetes, anxiety, depression, substance abuse, and that's all income backgrounds, all demographics. So that's our vested interest in having the kids back at school. As we all know, any kind of testing will not reduce transmission or guarantee a safe school environment. It's more about another layer of protection and an option for staff. So far the research is not really conclusive about spread between children. It does seem that spread between children is much less than spread between adults. But spread from children to adults and then spread from adults elsewhere in the community is a huge concern. In our specific experience over the past 5 to 6 months, a lot of our mutual clients, our patients who are students in the schools, their families have already had it, but there's new research showing that those very mild asymptomatic cases, the immunity is not going to stay as long as we may have hoped at the beginning of all of this. So testing will still be necessary regardless of who's had it and who hasn't had it. Just for comparison, and of course this is a very different situation financially, dormitory-wise, but Bates plans to test people twice a week, and I'm sure everybody has seen that. We want to make sure that our kids in the public schools and their families and staff also have access to robust testing. Is it going to be twice a week? No, because a variety of reasons. A lot of resistance to testing in the community being one of them, but also because the CDC really doesn't recommend that kind of routine testing or universal testing. Only shows us that moment in time. If we test every kid or every teacher before they go back to school, who's to say they don't contract it 48 hours later? So that's a little bit of the background. We will move on. Already explained who we are. We've got a lot of LPS kids in our dental practices, pediatrics practice, which is at St. Mary's, B Street, FHC, which is across the street at St. Mary's, CCS psych, counseling departments, and of course school-based health. Right now there's testing available at lots of places in the community, and there's new stop and swab testing popping up. Some of that communication back to the child's own PCP or family is where we perceive the barriers will lie when the school starts. Right now we have a temporary, it was supposed to be temporary, long-standing testing site at B Street. St. Mary's Urgent Care will also take all patients regardless of whether or not you're a patient in our system, and same with the site at B Street. CMMC also has a test site, and there's a few other facilities. About DOE guidelines, I'm sure you guys have already been through all of these, but if not, they're very, very detailed. What's missing from those recommendations is testing. This is all great for prevention, but when you get that positive case, how are we going to prevent shutting down a grade or shutting down a school or shutting down, a neighborhood or an apartment building, to prevent panic from ensuing? That's where we want to have testing available. So, this is where the lingo gets a little bit tricky. COVID swab, and I'm sorry if this is very repetitive for people. nasal or nasopharyngeal swab. Right now we're just doing nasal. It doesn't go way deep in, just right around the nostrils. Kids have been tolerating it really well. That will measure the presence of the infection at that point in time. If it's very early on, or if it's too late, or if there's some sort of issue with the specimen collection, you can get a false negative. Generally, a positive swab will always mean that the person is infected. But with a negative swab, there's still a chance that the person is infected. The blood tests are the antibody tests for immunity. Those are not being recommended either medically or with regards to school reentry right now. So a lot of people are asking about antibody testing because they want to know if they're immune and they want to know if their child is safe to go to school and not bring it home, but we really have no data on what those antibody tests really mean. So that is not a part of what kind of testing we'd be offering for anyone at Lewiston Public Schools. And this is where I welcome the questions, because this is where it gets a little bit tricky. We have a rapid testing machine at V Street. It's also available in a few other locations. That will result a positive test in 5 minutes and a negative test in 13 minutes. There's been a lot in the media about rapid testing, positive and negative. Of course, with the Abbott ID now specifically, it's made in Maine, so there's been a lot of communication about it. It's also the machine that the White House uses, so when it starts to get political, there's a lot of opinions on all sides. But it is recommended by the CDC. They strongly advise us to get it at B Street because of the high number of cases in the downtown community from March until now. We do a series of quality controls on it, including sending duplicate swabs to the state lab to confirm whether or not the testing is accurate. So we're still using the state swab system, but we anticipate possibly some uses for the rapid system as well. In the community, we've seen, in March and April, everybody wanted to be tested, and we had a very high percent positive, 33% at our site. And there's been a lot of discussion about racial disparities, but it's really just a Lewiston disparity. We have kids in crowded housing, we have kids whose families are essential workers, and we're seeing this played out all over the country. So it's an issue for everyone in Lewiston, not just specific kids in specific neighborhoods. The goal when you do kind of broad-based testing is that only 1 to 2% of your results will be positive, and ours have been closer to 20 to 33%. So at the beginning, people really wanted to be tested, and then once people had to be out of work, and some workplaces are not following the law in terms of reimbursing people when they're out of work. So if you get tested and you don't get an answer for 3 to 5 days, and then it's negative, but then your workplace may have a guideline that you still have to be out for a period of time. If that happens to you over, 4 months, 3 separate times, you've lost a lot of money just because you were trying to be cautious when you've had contact with a positive. So we're cautiously optimistic that having the rapid will reduce a little bit of that. Enough about that. Of course, no parent or child should ever be forced to have a COVID test. You're going to have all kinds of options for remote learning. And Tanya. Yeah.
Are you finding that the people who are getting tested are showing signs, or are they just getting tested?
Well, good question. So a lot of the people who are getting tested are showing signs. A lot of the people who are getting tested because they had a positive contact. And what's scary is that most of our cases have had very, very mild or no symptoms. So I guess to answer your question, people are getting tested for all kinds of reasons, but most of them are not critically sick. And many of them, I would say, are spreading it to many more people than we're catching. Not because they're not being careful, but because they're working and they're living in, large families or whatever the case may be. So there may be a lot more positive people out there who are asymptomatic than we're even aware of.
Now, can anybody come and get tested?
Yep. We're already testing anyone, including those who are not our patients. In the beginning, we were only in a situation where we could offer it to our patients, but now anybody, even if they don't have a PCP, can be tested. We did a Saturday clinic just as kind of a trial run 2 days ago, and we did 63 tests. in 4.5 hours. A bunch of those did not have their own doctor, so.
So, 2 questions.
Yeah.
On the rapid tests, which you are currently offering?
We're offering it, we haven't been using it as much, more because by the time you get the thing in the machine, it takes so long that if we've got a bunch of people lined up, it's easier to do 5 minutes on a swab that's gonna be a send out for 3 days, rather than waiting for the machine to process the swab for 13 minutes before we can even do the next one. So yes, we are offering the rapid, but we haven't used it that much.
Okay. Rapid or the send away?
Yep.
What's the percentage on false negatives?
So that is up for debate, because let's say someone gets a negative.
Yeah.
If they never really had symptoms, they're not going to be retested
Right.
to ever find out if they were truly positive.
Right.
So if someone has a negative and then they become critically ill and they get retested when they enter the hospital, they may then be a positive, but thankfully we haven't had that many people become critically ill, which is great, but it means that I personally don't have that data for the people we've tested.
Broader than just what you've tested, what's the generalized expectation on that?
I'd have to look up nationally what they would say, but I don't know if Colleen, you've seen any data on that. It very much varies by what kind of equipment the lab is using, and it could be anywhere from 1% to 10%.
Okay.
So I think nationally we really don't know, because there's no way to tell if those negatives ever become positive unless they become critically sick.
Okay. I wasn't sure if someone had done sort of.
Somebody probably has, but that person
Yeah.
is not me.
Okay.
I'll just make a point to that, is that there's a risk of false negatives regardless of the test. That's not unique to COVID-19. That's true
Right.
of
Yeah.
flu tests, that's true of strep tests. There's that risk, but we do know that the positive test is accurate.
Right.
And so that's really reassuring. And so we do treat, another point to make is we do treat anyone with a positive test as well as a negative but developed symptoms or has had a close contact with positive. The guidelines are really pretty much the
And
same.
I'm going to get to that too. There's a, not in the PowerPoint on your Google Drive, but in the original brief text packet, there's an example with, if Susie is positive in a classroom, what does that mean for everybody else? The reason those guidelines are so broad and cautious is because we just don't know about the false negative. But testing is still valuable to prevent a larger outbreak.
Right. My next question is about cost, I'm sure we'll get to school district plans, but if a community member walks in off the street, what's the cost of having the test?
It's free.
Okay.
Yep. And we can't bill for it for a variety of legal and financial reasons. It's just a nurse visit, not just a nurse, I'm a nurse, but
Right.
it's, that person is not having a full evaluation. If they're critically ill, they of course have to go to the ER and the ER will test them there.
Right.
But we do not receive any reimbursement. Main Care covers it. Most private insurances have a variety of things that they do if you get it at an urgent care or you get it at a stop and swab. But the CDC and Maine DHS has issued a standing order for anybody to be able to get it. And at B Street, it will always be free. So we're jumping around a little bit. We've done most of this. Of course, any parent or family can get a test whenever they want, or can refuse a test, or decide they don't want a test whenever they want. But this would really be for a situation to support a school employee. If there's a family who's struggling with access, if there's a family who doesn't have transportation, if there's a family who can't coordinate something, that's when the nurse or a teacher or administrator might be able to offer a test at B Street if they wanted it, to prevent spread to the rest of their family and their community. I think right now we have a very positive informal relationship with the schools. If Missy, the nurse at the high school, picks up the phone, she'll probably interrupt me if I'm with a patient, and if we have a mutual patient, we can help each other out. But this would be more of a formalized workflow so that every nurse in every school would have knowledge that they had a resource. So this is where we get to the risk of false negatives. Regardless of what the individual child or staff member's result is, if they had close contact with a known positive case, they still have to quarantine for 14 days. Just because they had that negative test does not mean they can come back to school. But if they have that negative test, we don't necessarily have to worry about their brother's 3rd grade classroom or testing all the contacts of that negative. So this is where it gets very logistically confusing, but this is also where it can be helpful. Anyone who's a teacher or a medical provider knows that from October to April in Maine, we've got kids with low-grade fevers, we've got kids with runny noses. In Lewiston, we have a high percentage of kids with asthma, kids with allergies, kids living in housing where there's environmental triggers. And when those kids show up at school and there's some sort of screening going on, I'm not sure what you guys have discussed in terms of, you know, self-reporting symptoms or a temperature check or a teacher even noticing that a kid has a really runny nose. How do we make good decisions in those situations without excluding the kids who chronically have runny noses? So that's where, if they are symptomatic, technically they still need to be home. But if we can test them, it'll give families and schools a little bit more of a reassurance that maybe this is coming from another medical condition. That's where you probably have to decide, you know, at a school level. We wouldn't be able to decide for you is what kind of screening you would undergo. But if you are symptomatic, you have to be home until your symptoms improve. Until your fever goes away, 3 days with an improvement of respiratory symptoms. Doesn't have to be 100%. So this, I put this on a few weeks ago before the Maine state green, yellow, red started to be more of a discussion. This is the CDC's Are You Ready to Open Schools? I would consider that we are a yes because you guys have talked about all of this. When it comes to the red, yellow, green for the state, I don't want to speak prematurely, but chances are that a place like Lewiston, Portland, we have more kids, we have more numbers, we're going to have more cases. That's just the way it's going to be. But what is that going to mean in terms of what we have to offer for those kids who do have to be physically present in school? So, you know, I think the logistics are a challenge, but the act of testing a staff member or a child itself is not a challenge. So I just wanted to make everyone aware of that tool, and I think it will go a long way in putting at least the adults in the schools at ease that there are options. Open to any other comments, questions, concerns.
Sarah, thank you so much.
You are very welcome.
Yes.
Jake, on the agenda, it talks about needing to approve the proposal.
So the rationale says that there's no motion required, but it is worded as to receive and approve their proposal. So I don't know if we need to, do I move that we approve it? Not sure if we need to approve it.
Not sure if you need to. I think, like,
I think it's just worded incorrectly, and that's all I'm trying to put out there.
Well, I guess, I think it's important that we have at least some dialogue that we would share this resource with family members, teachers, as something available. I'm not think we're forcing it upon anyone, but I know this conversation first started up when they were looking at phase 1 opening for socially distanced athletic conditioning, July 6th. I don't know if you recall when that started up. And part of that conversation was, well, if a student reports, or a student athlete or a coach reports, I think I feel 3 of the 12 screen items. So I feel like I got a little bit of temperature, my nose is running, and pick one of them. Well, from the phase 1 reopening of the athletics, the conversation then went to, All right, so you should probably test it before we have the spread. And then, I know Bobby was involved, and as well as Mr. Fuller, our athletic director, who was saying, okay, what resources do we have in the community that if an athlete wants to return to the program, we have to have these protocols in place so that they can do so. And I believe that's where Carol came in with the ability to do the testing. For example, if a coach has symptoms, the program is at risk of a 14-day pause. And so when we looked at the opportunity to do some of this testing from a prior agenda, that was why we brought it back. So I guess while the rationale doesn't necessarily say that this requires a vote, I guess I want to get some level of direction from the school committee that we're okay to share this resource with the community as a school department.
Member Majerus' Collins' questions and the subsequent answers make me comfortable with that, the fact that there is no cost, and it could offer some level of reassurance, but also it's not, perfect yet. I think that reality and that delivery of that information is really critical. It is a tool in the toolbox, however, not the only thing we're going to be doing. So it sounds appropriate to me.
So in my family's case, I have a 19-year-old son who works in the upper mall, who is wearing one of these things 8 hours, 3 days a week. He also has seasonal allergies. So for the last 3 months, it's been runny noses and stuff, sinuses and a nonstop dry cough. And he's like, can I even get tested? How much is it going to cost? I'm like, I don't know. So I didn't have, which is great. I think there are a lot of people in those shoes. I think it would be highly irresponsible of us to not share this information, because there are people that have no idea that there's even an option to get tested for free.
I think looking at the stated public agenda, because it says to receive and approve, I think there's a motion to receive and approve that says it as an offer that we would make aware of the public.
I move that we approve.
Second.
Any further discussion?
I'm going to add one more quick positive, if I may. When the kids did return to sports, I was completely expecting that every child was going to deny any contact or any symptoms. And they were all so honest because they just wanted to follow the rules and get back to it so badly that it was then very heartbreaking for the adults involved to not be able to offer them a resource. And that wouldn't be because when they get the negative test, they can come right back to sports. That's just to offer them something for their families. And a lot of the kids, a couple of the kids called their PCP and were given appointments in late August because they didn't effectively communicate what they need. And we recognize in the healthcare system that that's what it's like to try to navigate the healthcare system. And it stinks, but that's what it is. So if the schools have like a shortcut, that's a great thing to have.
We want to be as low barrier as possible, so that's our goal in being a resource. Any further discussion? All in favor? Oh, sorry.
No, it's fine.
In favor. It's unanimous. Thank you both.
Thanks.
Thanks for the opportunity to come to that. Thanks for all the careful planning you're doing.
Madam Chair, 5 minute recess.
Yeah.
Yeah.
Yes, everybody would like to take a 5-minute break. Yeah.